about sex. All the time.
You're 17. It's not that unusual.
Sex is for procreation, that's all.
Huh. So how'd you come to that understanding?
My parents. The reason those guys beat me up, I was climbing on a dumpster by the girls' gym and was looking in a window to the shower.
And that sounds to me like grounds for disciplinary action, maybe? But I mean, not a beating. I mean, certainly not castration.
Blonde girls. It's blonde girls. Follow them. There's this one girl, Lacey. She's blonde. I sit behind her, intrigue. One day, I cut this off. She didn't notice. I'm afraid of what I'm gonna do. I was looking up castration online. They can do it with drugs. That's what I want, chemical castration. I don't want to hurt her. Or anyone.
Elliot is very troubled. The poor kid is just consumed with sexual thoughts.
Aren't most kids his age?
Yeah, but he's been raised to believe that sex is wrong unless it's for procreation. And repressing his natural urges is triggering aggressive impulses, which he's struggling to control.
Aggressive?
Fetishizes blondes, stalks them.
You're talking about a sexual predator?
Not a psychopath. I mean, he has a conscience. I mean, I think he could definitely benefit from therapy, but I'm not ruling out those meds.
Chemical castration, really?
It's temporary, Ethan. Raping somebody isn't. We would need the parents' consent.
So kid got beat up. What does he need a psychiatrist for?
Well, Elliot was caught peeping on girls in the shower at school.
Oh my God.
Wait till I get him home.
But much more troubling are some violent impulses that, so far, he hasn't acted upon.
And there's something we can do.
Elliot wants us to give him a medication that would turn off his testosterone. This would significantly decrease his sex drive and make it much easier for him to control these impulses. But we do need your permission to do it.
Turn off his testosterone. What exactly are you talking about?
The medical term is chemical castration.
What?
It's completely reversible. The idea would be to combine it with traditional therapy with the hope of ultimately weaning him off the medication.
No way.
Elliot could very well be on the verge of acting out on some very disturbing impulses, including rape.
You would never do anything like that.
You people are sick.
Again, this was your son's idea.
Elliot is torn up about this. He's scared he may not be able to stop himself.
This is ridiculous. Fix his eye, and we're taking him home.
Mr. and Mrs. Gallagher, I need to get Elliot up to pre-op holding. The eye surgeon will be calling for him any minute.
We'll be in the waiting room.
I'm guessing your parents told you they wouldn't approve the chemical castration.
No. But my mom read me Thessalonians 4:3. God's will is for you to be holy, so stay away from sexual sin and immorality.
Both Dr. Charles and I tried, but since you're still a minor...
Yeah, I figured. All right, whatever.
Look, I'll talk to Dr. Charles and see if we can come up with some other options. Elliot? Elliot? are you doing?
She looked cold.
Step away from her. Now.
Elliot! Elliot, open the door! Pay security! Elliot! Elliot! I need a gurney with softer space and some baby knee pads! Give me some ice. At 50 mix fentanyl IV now, I'll pay urology. Just relax. Elliot, just relax.
The procedure to repair the testicles is complicated, but the urologist is optimistic.
How did this happen? What did we do?
You know, in my experience, there's actually very little to be gained from looking backwards. The important thing to focus on is, what do you do now?
Her name is Karina Goff. She's 16 years old with a history notable for Williams syndrome. Her mom found her passed out on the couch.
Williams syndrome, you ever seen it?
No, never. It's a genetic disorder, right?
Uh-huh. It's commonly associated with cardiovascular disease. But even more striking is their personalities. They produce enormous amounts of oxytocin, which is the hormone commonly associated with feelings of trust and the desire to be social. They're very interesting people.
Hi, Dr. Clark.
Hi, Karina. Wendy, this is Dr. Latham and Dr. Rhodes.
Hi, Karina. Oh, I like your earrings.
A moon and the stars.
I see that. So, how are we feeling today?
Tired.
Still awake enough to donate her entire allowance to UNICEF this morning, which is what, the third time this month?
Is this the first time she's fainted?
Yes.
May I listen to your heart?
Mid-systolic ejection murmur over the right second intercostal space.
Aortic stenosis?
Probably. Let's get an echo.
Okay.
Can you make me better?
I am going to try my best.
Okay, dear, let the doctor breathe.
Doctor.
Let us run a few tests. We'll be back with our recommendations. Miss Goff. Hi. So, we got Karina's test results. The large vessel leaving her heart has become severely congested. It's making her heart work harder and harder and decreasing the amount of oxygen that it can deliver. That's why she's become so tired and listless.
Oh, God, what do we do?
We recommend an operation to either fix the aortic valve or replace it.
Heart surgery?
Yes.
Hi, Dr. Rhodes. What are you guys talking about?
Dr. Rhodes was just explaining your test results.
Hey, Karina, why don't we get you back to bed? There you are. So, based on what I am seeing, I believe you need surgery.
Will that make me better?
Well, there are never any guarantees. But if things go well, then yes, it will.
Good. Then I want to do it.
It's not that simple, sweetheart. We need to think about this. Give the doctor and I a minute.
Okay.
I'll be right back.
I know you think surgery has the best odds, but I also know that Williams patients have a much higher chance of not surviving general anesthesia.
I completely understand, but the fact is, her condition is quite advanced. And she did express that she wants a surgery.
She doesn't understand. She says that just to please you.
Well, she may not be able to make a completely informed decision, but she does know how she feels.
She's under 18. It's my decision to make.
Shouldn't we at least let her be a part of the conversation?
Dr. Rhodes, Karina is not like your other patients. I want options.
Okay. Let me talk to Dr. Latham, see if he has any ideas. It must be hard.
It is. She is such a bright light. A breath of fresh air. You should see how people spark up when they see her, and how happy it makes Karina. It's like she feeds off of it. If you don't operate, I'll be taking that from her. Do the surgery.
We'll get her upstairs shortly.
This is so unnecessary. It was probably that sketchy salad I had last night. Remember, I said it smelled weird.
Jenny's been in pain since we left Fort Wayne 3 days ago.
Hoosiers, huh? Winter getaway?
College tour. Jenny got into Northwestern.
Perfect SATs.
Wow, congratulations.
Jenny, are you feeling any nausea?
I mean, a little, but I'm better now. I don't know why you guys are freaking.
Oh, honey.
We thought maybe appendicitis.
No rebound tenderness.
BP 100/62, heart rate 103. I told you, it's just food poisoning.
Right, well, I'd still like to do a quick ultrasound just to see if I can get a visual on the appendix, okay?
An ultrasound?
It'll just take a second.
No, I don't want that.
Honey.
I want to go.
Jenny, appendicitis is serious, but it's easily treatable if we catch it early. But I have to take a look to do that, okay?
Jenny?
Okay. I guess.
Right.
Well, good news is it doesn't look like appendicitis.
So, what is it?
Well, it's hard to tell just yet, but I would like to run some tests just to rule a few things out, if that's all right.
Oh, of course.
Yeah, absolutely.
Monique, CBC, BNP, coags, and a quant HCG.
We'll be back to check in once we get the test results in. Thank you. Did you see how scared she got when I mentioned an ultrasound?
Yeah, she was pretty defensive. You think what I'm thinking?
Pregnancy?
Thinking endometrium, but I didn't see an embryo.
Well, she could have had a miscarriage or an abortion. And whatever it is, she is definitely trying to keep her parents in the dark.
But I don't think that's gonna be possible.
Ethan. Jenny, where are your parents?
They went to get coffee.
We have to ask you something.
Jenny, we got your blood work back, and it indicates a pregnancy.
No, I'm not pregnant.
Let us explain.
I'm not pregnant.
We understand how hard this is, but your test results and your symptoms shows that maybe you had a miscarriage or...
No. No, I didn't. I don't want to talk about it.
Jenny, in order for us to treat you properly, we really need to know what happened.
Please. We are not here to judge you.
No.
We want to help you.
The whole thing was stupid. So stupid. So when I found out that I was pregnant, I didn't know what to do. I'm finishing high school and I'm going to college.
I understand.
So I went online and I read about these pills.
And what were they?
Mif something.
Mifepristone? Did you take the follow-up pill, misoprostol?
Couldn't get it. Not without a doctor.
Jenny, that's why you're in so much pain. Without the second pill, you haven't fully aborted yet.
Help me. Please. Just don't tell my parents. They'll hate me and they'll never forgive me, please.
I think you might be underestimating them.
No. I know them and you can't tell them.
Jenny, I'm sorry.
We're not going to tell your parents. But I am going to give you the second pill so that you can expel whatever is left in your uterus, okay?
Thank you.
Yeah.
Yeah. She's a minor. We can't give her medications without her parents' consent.
Yes, we can.
Dr. Manning, have you found out what's wrong with our daughter?
We were actually just discussing that.
Unfortunately, we're still waiting on some test results. The best thing you can do right now is just be patient.
That's it? You have no idea?
I know how frustrating this must be, but I promise you we are doing everything possible for Jenny.
I'm sure that you are. Come on.
What do you think you're doing?
I'm honoring my patient's wishes.
You're lying to her parents?
I did not lie to them.
You withheld the truth, Nat. They have a right to know, a legal right.
That's Jenny's call. If you have a problem with it, take it up with Goodwin.
Dr. Manning boxed us into this situation.
You want to talk about boxed in? The only reason we're in this situation is because Jenny had no options. The family lives in Indiana.
Where she would need parental consent.
And she was afraid to talk to them, so there was nowhere else to go, so she went online to find medication. This generation's back alley abortion.
We don't make the laws, but we have to obey them. Jenny's a minor, and that means we have to tell her parents before we treat.
No, her pregnancy test is still positive. Therefore, under the law, she is emancipated.
She was pregnant, not anymore.
Technically, she still is.
Miss Goodwin.
I'll admit it's a thin argument. Emancipation covers a woman's decisions regarding her pregnancy, but my understanding is that Miss Simpson has already made her choice.
So we betray this girl's trust?
Well, that's not what I'm suggesting.
We have to obey the law and tell her parents.
Oh, that's not exactly right either. If we had provided medical abortion, which we didn't, then yes, the state of Illinois says we're obligated to inform the parents. But since she obtained the medication herself out of state, I'm not so sure.
So you intend to keep the parents in the dark based on a technicality?
No, because our patient asked us to keep it confidential.
Look, I would suggest you continue to treat her according to her wishes until our lawyers make a determination.
Thank you, Miss Goodwin.
Help!
Sweetie?
Dr. Manning! Dr. Choi! Oh my God.
Help her!
I feel dizzy. Jenny, keep looking at me. Keep talking, okay? Mom. Are you okay, honey? Mommy is right here. I don't feel good. Oh, God.
What is happening to my daughter? There's so much blood.
It's a gynecologic hemorrhage. She's passing retained tissue
You need
from...
to control the bleed. Monique, hang a unit of typed and cross-matched blood. Give her 0.2 milligrams of methadone IM, and I need a stat, CBC, and coags.
Wait, we need your parental consent.
Ethan.
To start the transfusion and administer the medication.
Whatever you need to do.
Go ahead.
Since your patient, Jenny Simpson, is a minor, legal is concerned about liability.
Of course they are.
Bottom line, if you feel the need for any further medical procedures, you must obtain parental consent.
Good. Thank you.
This isn't right.
I'm sorry, Dr. Manning, but you've given her methadone, yes?
Yes.
So let's hope she passes any retained tissue. That should take care of it.
Hi. Can we have a moment to examine Jenny?
Oh, of course. When are we gonna know something?
Honey, let them do their job. Come on.
Thank you. How are you feeling, Jenny?
I'm not good. Well, I am going to do an internal exam, okay? So I just need you to lift up your legs just like that, and then just let them fall open. Perfect.
I apologize. This is going to be a little uncomfortable, okay? Thank you. All right, you ready? You okay?
What is it?
Well, your body hasn't expelled all the tissue related to the pregnancy. So the medication we gave you was supposed to help, but unfortunately, you're still bleeding.
It means you're gonna need a DNC, dilation and curettage, a surgical procedure to remove the tissue.
But we do need your parents' permission for this.
No, you can't tell them.
We have to.
Jenny, your temperature is elevated, which means you could be developing endometritis, which is a very serious infection.
It could be life-threatening.
No. No, no.
Jenny, I know you're afraid of what your parents will say, but they love you, and they would never want to lose you. So I'm gonna go talk to them, okay?
Wait. My mom. Ask my mom to come in.
Okay.
Mrs. Simpson, Jenny would like to talk to you.
Oh. Hey, why don't you go get a cup of coffee? I think this is mother-daughter talk. It'll be okay.
I knew it all along. You had no right to keep this from us.
It was Jenny's wish.
Well, of course she didn't want us to find out. She knew it was wrong. What she did was murder.
Mrs. Simpson, You should know that Jenny didn't want to tell you because she was afraid you wouldn't love her anymore. No. No. Listen, no matter what your beliefs are, that's your daughter, and she's very sick.
Can I give the consent for the DNC without my husband?
Yes?
Do whatever you have to do to save my daughter. Just don't tell Joel what happened. I don't want this to destroy my family.
But doesn't he have the right to know he's her father?
Actually, he isn't. And no, I never told him.
Here is the reason for your tummy ache, Shannon. You have an obstruction in your stomach.
Oh dear.
It's not a growth. It's clearly a foreign object. What did you eat?
Nothing.
You must have swallowed something.
It's the only way it could have gotten there. I don't know. Honey, think. What could it be? I had some of those little carrots.
No, a carrot wouldn't reflect X-rays. This is dense. It's metal or ceramic, maybe some kind of toy.
Honey?
I don't know. Won't it just come out eventually? You know, peristalsis.
Well, whatever this is, I don't want it moving through you. It could cut the bowel, and that would be serious. With your permission, I'd like Shannon to have an endoscopy. We'll sedate her, put a scope down her esophagus, and get the thing out. It shouldn't be a problem.
Oh, God.
Don't worry. It'll be over before you know it. All right.
Hey, Nat.
Yeah.
I pulled this out of the gut of a 14-year-old girl. Any idea what it is?
I have never seen anything like it.
Me neither. Care to find out?
Yeah.
Shannon, Mrs. Fisher, this is Dr. Manning.
Hi.
Hi.
We removed this foreign body from your stomach.
That was inside her?
What is it?
Shannon?
It's mine. I need it back.
Is that something you made in the basement?
You made that?
Tell them what it is.
It's a prototype.
For what?
A robot.
A robot?
The idea is you swallow it.
You swallowed that?
And it can clear blockages or repair intestinal wall without surgery.
Excuse me, clear blockages? It caused a blockage.
Okay, so it needs work.
What exactly goes on in your basement?
Shannon and her friends, they call themselves biohackers.
I'm a body hacker. Kyle and Jen are biohackers.
Biohackers, genetic engineering, a bunch of kids?
They make things. The DIY generation turned our basement into a lab. I can hardly get to the washing machine. I do not want you experimenting on yourself.
I'll second that.
Yeah, seriously, this was very dangerous. You could have cost yourself an operation.
You listen to the doctors.
Can I have it back? Please?
That's up to your mom.
Body hacking? They could really hurt themselves. Should we report this to someone?
Oh, it's not illegal, it's just crazy. Kids, where do they get these ideas? Listen to me, I sound like my dad.
Oh, your dad would be right.
Still, makes you wonder what goes on there.
See ya.
Thanks. I hope this isn't inconvenient. I'm just concerned about what Shannon and her friends are up to.
Believe me, they won't mind. They love to show off their lab, little mad scientists.
But you're very supportive.
They get so excited, they think they can do anything. Listen, I had to give Shannon back that gizmo. She said she'd never speak to me if I didn't. Shannon, look who's here.
We're culturing gut bacteria over here. Maybe we can reprogram some E. coli Nissels to boost the immune system.
But Nissel's not dangerous. So what level of safety are you operating at?
BSL 1, maybe 1.5. What we're doing here doesn't need more than that.
And who's supervising all of this?
Miss Herbert, our biology teacher. But I don't think she really gets what we're doing. She just tries to make sure we don't kill ourselves. Oh, this is cool. Kyle, show her the ear. He took a slice of apple and implanted it with HeLa cells.
The cellulose in the apple is kind of like scaffolding for the cells to grow on. Wow. That really looks like an ear.
Well, it's not. I carved it to make it look like one.
But it's not Apple anymore either.
Well, when I was your age, I was working with hippocampal cultures, studying the transduction pathways with short interfering DNA. I know, big deal. So 1995.
You were a science geek too?
Mm-hmm. And I would have killed to have a place like this. Let me ask you a question. What do you know about non-Hodgkin's lymphoma?
Blood cancer. Body produces a lot of abnormal lymphocytes.
How'd you like to give it a shot?
Talk to me. Female, late teens, hypothermic, GCS of 9. Trauma 2. Can barely feel a pulse. She's really cold. I got her. Male, early 20s, fell off a plane at touchdown. Let's go to trauma 1. Left chest is crushed, unable to intubate.
Pale and unresponsive, get intubation drugs. 20 of etomidate, 100 of sucks. Get a labs and a base deficit and trigger the MTP and start transfusing as soon as the blood shows up.
On my count. 1, 2, 3. Transfer.
All right, let's get that board out. Got it.
Let's get a CBC and a crit.
Okay, let's roll him over. And roll.
Hold him steady. Pull. Right here, Maggie.
Miguel. Miguel.
What's your name? Can you tell me your name?
Miguel.
ABC's intact, GCS 9.
All right, get warm saline bags in her axillae, groin, and behind her neck, and let's cover the top of her head to keep whatever heat she has in.
On it.
Too much blood in the airway, can't see a thing.
Okay, we're gonna crank this guy.
We're gonna need about 3 more. Get a core temp.
All right, let's get the X-ray and the fast scan in here now. Drink set, got it?
Got it. I'll bag him.
How's she doing over here?
Heart rate's 50. Temp is 29 Celsius, still responding.
Breath sounds bilaterally, right is really muffled.
What the hell happened?
Stowaways from Mexico. He fell out of the plane. She came out of the wheel well after landing.
All right, let's get a look at his chest. X-ray clear. Hemopneumothorax. Dr. Choi, get a chest tube in on the right.
You got it.
Roll.
All right. Scanner.
Here.
Thank you.
Pressure's down.
There's blood throughout his belly. We need to get him up to the OR now. He's gonna need a lap.
On it. Calling the OR. Yes, 100%.
Okay, I need to set his leg. All right, Maggie?
Yep. Ready?
Okay, all right. All right. You wrap that up for me?
Yep.
Whenever you're set, go. We'll do. What's her core temp?
Still 29 Celsius.
Got the Foley in?
Yep.
Get 2 of her set IV, get the ECD in and set up for a DPL. We have a very short window to get her warm.
Versed in.
Go ahead and get me a flush. I need heparin. Ready to travel.
All right, let's go.
Okay. Start the infuser and set it to warm. Give me the big needle. Just use the level 1 to warm. Do not pressure infuse.
Got it.
ECD warming to 46 degrees.
Core temp's 35 and rising. Heart rate's up, 60.
That should stabilize her for now. Good work, everyone.
Nice work.
I'm afraid she's not out of the woods yet.
Hypothermia and hypoxia? That's like hibernation.
It's like minus 60 to 70 up there. What kind of screwed up life did she have that she took a risk like that?
Hey, no offense, but not everyone's born of roads.
Thanks, I keep forgetting that. How's she doing?
Still in and out of consciousness. Temp's back to normal. Still waiting on her charts.
Soy el Dr. Rhodes. ¿Cómo se siente?
¿Dónde? Miguel.
Her name is Maria Gonzalez. Miguel is her brother. He was the one that was brought in with her.
Right. Maria, your brother was very seriously injured.
Alive?
Yes, he is. Pero está en terapia intensiva. bajo medida de soporte vital.
Estaba tratando de salvarme.
Why was he trying to save you?
Nuestro padre, our father, is narco. Sinaloa. Not good man. Won't sell me. Pero mi hermano Miguel, take me. He get me out. Por favor, queda al Miguel. Queda al Miguel.
We will. Haremos todo lo que podamos por él.
Gracias. Gracias. Respira.
Sorry, I have to go. Descanse. Volveré pronto.
Respira otra vez.
Miss Goodwin?
Thanks for coming, Dr. Rhodes. These are Agents McManus and Ramirez from Homeland Security.
Dr. Rhodes, you have a female patient, a stowaway?
Yes, Maria Gonzalez.
And she was brought in with a companion?
She was. Miguel, her brother.
Her brother.
We understand he's unconscious in the ICU.
Mm-hmm.
We would like to talk to Miss Gonzalez.
I'm afraid that she's barely conscious herself. She's in no condition to be questioned right now.
Any idea when we'd be able to talk to Miss Gonzalez?
It's too early to say. This woman is a victim. Yeah, her father is a narco. He was planning on selling her. Her brother was only trying to save her.
Sounds like you've had extensive conversations with the semi-conscious Miss Gonzalez.
No, that's all I know.
Dr. Rhodes, you realize we wouldn't be here if this weren't a matter of great concern.
Yes, and he'll let you know as soon as you can speak to her.
Thanks. We'll be back.
And you can count on that.
Hold compressions.
What happened?
We lost him. Time of death, 11:32.
Whoa, 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 what are you doing with my patient?
All right, Doc, please, it's best you stay out of this.
No, she is under my care. Maria?
Dr. Rhodes, por favor.
Are you okay?
Let's keep him back.
Get off of me.
I'm sorry, but she's being repatriated home.
Now, she is barely stable. She can't go anywhere.
She's stable enough to travel. She can be accompanied by a doctor.
No, I can't allow this.
Doctor, I'm sorry, this is not up to you.
Miss Goodwin,
Yeah.
you backed me up with Homeland Security.
Yes, I did.
Then why did you let them deport Maria Gonzalez?
Not here, Dr. Rhodes. Give us a room. Homeland Security did not deport your patient.
No, I was outside. I saw them.
It's the hospital that's repatriating her.
The hospital. Why? We're doing this. Why?
Because Maria Gonzalez is undocumented and without medical insurance.
Legally bound to treat her.
Which we have done.
She is still in critical condition.
We contract with a private ambulance service. They provide medical personnel for the patient.
That's how you justify it, then?
Look, I wish I could wave a magic wand and fix it, but I can't.
Maria came here for refuge. Her brother risked everything so that he could help her, and he sacrificed his life. For what? For nothing.
Dr. Rhodes,